Welcome everyone to day 2 of the Adolescent Nutrition virtual meeting. I'm Natalie Roschnik from Save the Children, and I'll be moderating the first half of this meeting today, and Deepika Sharma from Unicef will be moderating the second half. So I hope most of you were able to join day 1 yesterday afternoon, which was such a brilliant meeting. If you're not, I'm going to I'll do a brief recap before the first presentations today. We did also record yesterday's session, and that will be posted on ENN's website shortly, so you can watch it retrospectively if you want. So just as a reminder, this meeting is hosted by ENN, Unicef and Save the Children, with support from Ireland's Department of Foreign Affairs. And I'd like to take this opportunity to thank especially ENN, in particularly Emily Mates, Natasha Lelyveld, Stephanie Wottersley, who really have been doing most of the work organising this meeting. So we decided to organise this meeting together and also part of the Adolescent Nutrition Interest Group to draw back attention to adolescent nutrition, take stock of where we are, and bring people together from around the world to discuss where we should be going. So since we cannot do this in person, we're doing it virtually over these 2 afternoons. So just a reminder of the 2 objectives for this meeting is the first one is to share information on some of the latest, some of the latest research and operational initiatives in adolescent nutrition, and second, to explore priorities for assessing and improving adolescent nutrition across policies and programming. So before I do the recap, I just wanted to give you a quick reminder of some housekeeping rules, or not rules, but just to keep in mind. So during the meeting, only the presenters and the panelists will have their audio and video on. So do please post your questions in the chat box. But as a reminder, please make sure you select panelists and attendees when you post messages so that everyone can see the questions and the answers, because yesterday a few people were just posting to panelists, and so people got responses without the questions. And then also, as you log off at the end of each day, there will be a link to a few short questions asking for some reflection on the meeting. So please do fill it in because it really helps us to get your thoughts and to improve, events in the future. So just a reminder of the agenda today. So after the brief recap I will do from yesterday, we'll be following a similar format. Where we'll start with 2 presentations. So we have Dr. Catherine Fleming from University of Western Sydney, who's going to be talking about how adolescents experience nutrition across the world, and then followed by Dr. Lynnette Neufeld who's going to talk about the upcoming Lancet mini-series on adolescent nutrition. And then we will have question and answers after those 2 presentations and have a short break following that. So please stay, don't disappear, and come back because after that we have a panel discussion with a few government and organisational representations on their perspectives on adolescent nutrition. And then we'll have a few polled questions like yesterday to liven things up. Check that your knowledge on adolescent nutrition. No, it's all anonymous, so we won't be checking your knowledge, but please join in those poll questions as well. So with that, I'll just do a quick recap of yesterday for those who were not able to join and for those to see what the key takeaways were. So first, we had a huge number of participants. I think at one point 325 participants were joining the meeting in total. And then the meeting started with setting the scene. After Emily Mates did a warm introduction, we had a presentation from the doctors Natasha Lelyveld and Stephanie Wottersley from ENN, who gave an overview of adolescent nutrition status across the 7 globes, which was based on a mapping exercise they've just conducted, so it was hot off the press. And the mapping included a review of evidence of existing DHS data and stakeholder interviews, which actually I was really impressed, included 133 people representing 42 countries, so quite impressive. And what that presentation really highlighted is the policy gaps. For example, there's a lack of adolescent specific targets in the WHA, the World Health Assembly 2025 and the SDGs, data gaps, so not enough standard indicators of malnutrition and targets for improvement, and evidence gaps as well, lack of comparable data across countries and regions, and evidence very much concentrated in certain regions and countries. So, for example, India and Nigeria had a lot more than others in their regions. And then the main recommendations that came out of that mapping moving forward is that we need better global consensus on how to define adolescence, how to describe adolescent malnutrition, and how best to intervene and how to engage with adolescents. So there were 8 sort of specific recommendations, which I'll just read off quickly. One is that we should have more standardization of the anthropometric definitions of malnutrition in adolescents. The second is that we need global and national targets for improving adolescent nutrition. We need more data on undernutrition and micronutrient deficiencies across the regions. Fourth, is the strategies. We need strategies to curb rising prevalence of overweight and obesity. We need more consistency in our measurement and definitions of malnutrition to enable comparisons, and comparable data across countries, regions, ages, sexes, urban and rural settings and socioeconomic groups. And increase more evidence on the drivers behind malnutrition, and more interventions and evidence of interventions of what works and how best to target adolescents. So, and I also just finally, Emily also shared ENN's Plan Future work, which I, would like to encourage you to join. One, there's a research prioritization exercise happening through the CHNRI, which I can't remember the acronym, maybe someone could put it in the chat box. There's also an adolescent interest group which meets quarterly, and it's quite informal, and we would really welcome your engagement. So please email Emily if you want to join that group. And then there's a field exchange, a special issue coming out, I think for sort of autumn, but we're really keen to gather as many, ENN is really keen to gather as much program experiences and recent research on adolescent nutrition. So again, if you have ideas, please get in touch with that team. The second presentation was from Dr. D. Jub from Empatica, and it was a wonderful sort of trip to Indonesia where we discovered 2 very different contexts of West Java and NTT, which is sort of near Papua New Guinea over that way. And she presented findings from an immersion research and people-centered design, which was conducted as part of the BISA project, with the Power Nutrition, Save the Children Nutrition International and others sort of supported project. But it was very unusual research approach, which involves living with people, and in terms of the adolescents, is hanging out with the adolescents for 5 days and using different ideation workshops and people-led activities to come to find some solutions. So some of the key takeaways is one, that it was focused very much on anemia, because 75% of adolescent girls in Indonesia are anemic, which is huge. It was fascinating to see through the pictures and anecdotes how different the contexts are, and also highlights how context really matters. There were huge differences. Also the challenges in researching adolescents, we need to be moving into their own space as opposed to bringing them into our space. They like, privacy and etc. And also a reminder that adolescent-focused work should be about building ownership and empowering youth and focusing on what matters to them. In this case, it was funny because it was, about having sleek black hair and boyfriends, and not necessarily about, getting pregnant immediately, or some assumptions we sometimes make. So then following that presentation, we then had panel discussion, really super energizing, inspiring panel discussion, sort of led and by youth leaders. So 4 very inspiring youth leaders, which was beautifully moderated by the Sun Lead group member Sophie Healy from Ireland. And within that we heard from Deepti Chowdhury from Bangladesh, who's worked for this SKNG, an adolescent network from a young age, and she reminded us all of, you know, the force of adolescents. Just in Bangladesh alone, there are 40 million adolescents, and this is a new decade, and a new decade for adolescents, and they are the change makers of this new decade. We had Webster Makombe, a Sun youth leader from Zimbabwe, who was saying how he only learned about nutrition when he was 17 years old, and he really wants all children and thinks all children should be learning about it at an earlier age. So he's working with schools and clubs and to build a culture of young people to have better, you know, to be healthier adults in the future and also healthier parents. You know, he was very keen to be a healthy and better father in the future. And then we heard from Tasha Makayokora, and I'm sorry if I don't I'm not pronouncing that well, from the UK, and she's a former co-chair and serving trustee of Bite Back 2030. And she first shared a brilliant and shocking video that I recommend you all watch. It's only 2 minutes. That was made by and for youth to build outrage on how the food industry influences our food choices. And she was really calling us to action to put young people at the forefront and to rethink the food system. So some of the key messages which came out of that is, one is that youth, the key messages that they were sort of portraying is that youth, we are not a homogenous group, so please do not treat us as such. We are not, please put us at the forefront of life in every system, global, nationally and local. I think it was Webster who said a really nice thing, saying energy of being a youth is short-lived, so we have to make the most of it. Soon we'll be too tired in 10 years' time, so let's make the most of it. And then there was a discussion about what meaningful participation was, and summarized also nicely by one of the youth about that it's about not just planting the seed, but also ensuring that the seed grows and that there is a result. Otherwise, participation doesn't count. You know, a lot of references of just tokenistic participation. And then there was a question about how COVID had impacted all of their work, and it was interesting to see the difference between UK, where there's high use of social media, and so it was actually quite easy to continue using social media platforms despite the COVID restrictions, whereas as in Zimbabwe and Bangladesh, where youth have data limitations, internet limitations, and had to they still then used WhatsApp groups and online learning to bring people together. Anyway, for me, I think that was really inspiring, and even though I have 3 teenagers at home, you know, I always struggled to sort of get them engaged in anything, but I did made me think that we sort of oldies, as I think they were calling us sometimes, working with NGOs and development organization, governments, really should be, how do we put youth at the forefront of our work and also pass the baton as well. So that was my quick recap of day 1. So without further delay, I just would like to move on to the first presentation of the day, which is Dr. Catherine Fleming, who's presenting on the Food and Me project and how adolescents experience nutrition across the world. So maybe just a quick introduction, presentation of Catherine Fleming. She's from the school, she's a lecturer in public health in the School Health Science Department at the University of Western Sydney, and is stream co-lead for youth participation and engagement in the Young and Resilient Research Centre. She has a PhD in pediatric nutrition and dietetics and over 12 years experience in pediatric nutrition relating to infant young child feeding, food allergy, childhood obesity and adolescent nutrition. And she is passionate about ensuring a sustainable nutritional change, that sustainable nutritional change occurs for children and adolescents through the co-designed and development of interventions by young people for young people. So with that, I think we have a poll to start off with. So there, it's up in front of you. Please answer those questions. What is the biggest influence on adolescent food choice? So please tick the box that you think is the one, and then I'm going to let Catherine give the correct response or respond to it in her presentation.
Thanks, Natalie. I'll let everyone answer that, and I'll keep them waiting. And as I work through my presentation, I will reveal the correct answer. But if you have a moment now to select one of those, that would be fantastic. I'll also get started now with my presentation. So thanks, Natalie, for the introduction, and thank you all for having me here today to share the findings from a project that was a partnership with Unicef. So the report that I'm presenting findings from today was titled Food and Me. It was a partnership between Unicef and Western Sydney University and positioned as a companion report to the State of the World Children's Report that was released by Unicef at the end of 2019. The study that I'm presenting today aimed to capture the adolescent voices from the field to ensure engagement with young people in nutrition conversation started early. The project utilised a distributed data gathering methodology. This methodology was first developed by the Young and Resilient Research Centre at Western Sydney University in partnership with UNICEF and Harvard University, and which has now been used in over 70 countries around the world. A key aspect of this method involves training facilitators with partner organisations who are directly working within different countries to run creative and participatory workshops and activities to then enable participants, in this case adolescents, to explore their own experiences of food and nutrition in a deep and collaborative way. A first step in this methodology is to develop a workshop manual to enable continuity of data collection across multiple countries in a way that creates spaces for adolescents to share their experiences. Once the manual is completed, country workshop facilitators are given the detailed manuals describing workshop content along with an online training. This allows for the upskilling and capacity building of partner organisations and adolescents themselves across the participating countries. In this case, we developed the workshop manual in partnership with UNICEF Advisory and included a variety of creative activities to collect food and nutrition information on the following topic areas: everyday food, food in your body, food in the media, food environments, barriers to healthy eating, and then solutions voiced by adolescents themselves. So as you can see here in the pictures, they involved all sorts of fun, creative activities with the participants. Activities often involve drawing, acting out scenarios, brainstorming, games, collaging pictures, and many other ways to get adolescents to express how they felt about food and nutrition in their everyday lives. Participants routinely told us that these methods are not only engaging, but also build an understanding and enthusiasm for nutrition. I will share in some more detail some specific activities from the manual that looked at dietary intake, body image, and barriers to healthy eating. Specifically for dietary intake, we adopted a 24-hour recall methodology. As a gold standard dietary assessment tool, we are not going to try and apply or replicate this validated tool, but rather take the underlying ideas of recording what a person had eaten in the previous 24 hours and apply a creative methodology by having the participants self-record what they had eaten in the previous 24 hours through drawing what they had on a timeline, either drawing or adding collaged pictures of what they'd eaten in those previous 24 hours. We then also overlaid asking them about their nutritional knowledge and got them to indicate what foods they felt were healthy or unhealthy. So you can see here a participant ticked their eggs with a green tick, indicating that this was they deemed a healthy food. We also asked them to star what their favourite foods were. So we not only collected dietary information, but we also wanted to have a bit more of a rich context around how and what they viewed the foods they had been eating in that previous 24 hours. Another intake-based activity related to drawing what the participant had for dinner the previous evening. We also followed this up with a short answer option about why they ate this food and if they saw this food as a healthy part of a meal again, trying to build a context around what the dietary intake information they were providing us with. We are also interested in how adolescents perceive their bodies. To further investigate this, we adopted a standardized silhouette testing method for a cross-cultural application to ask adolescents about their current body perception and to help address evidence gaps in lower income countries about body image. We achieved this by utilizing fruit rather than actual body images. So you can see on the left-hand side there is what the standardized tool would normally use in terms of silhouettes of an outlined body shape. We felt this might be confronting to different adolescents in different cultural settings. So instead of that, we replaced these with different shaped fruits. Adolescents then had to circle, you can see here in the red on the right, what they felt their current body shape was. We then asked them to circle what they felt their ideal body shape was, which this participant circled in the black. And then we also asked them to star what they felt a healthy body shape represented for them. For barriers and to gain an understanding of what barriers and, let's say, hurdles young people face in accessing a healthy diet, we asked them to complete this obstacle course or worksheet, where they needed to write down or draw on the sheet what hurdles they had to jump over to access healthy foods. They were also asked to provide an information about why this obstacle makes it difficult to eat healthy foods and what are some of their everyday workarounds. So you can see here the participant from Mexico indicated 3 main hurdles for them. One was they actually just like having junk food. One was they don't know how to prepare it. And another one was not having enough money. After completion, all workshop data is digitized and uploaded to a secure online repository for analysis. Data analysis occurs using qualitative thematic coding and quantitative descriptive statistics generated from dietary codes under the NOVA classification system using minimally processed, processed culinary foods, and ultra-processed foods. We fully acknowledge this is not a population-based measurement of dietary intake, so the data is only a snapshot of what participants ate in the previous 24 hours and is not generalizable data. So now let me share with you what adolescents across the globe shared with us. The data was collected in 2019, so it was prior to the COVID pandemic. Unicef country offices in 18 countries conducted 37 workshops with 656 adolescents in rural and urban locations across the globe. These countries were predominantly lower income countries, but also included the US and Australia. A diverse range of adolescents participated, including some highly vulnerable groups such as displaced refugees in Sudan. Adolescents said they valued good nutrition and saw it as an important part of a healthy and prosperous future. However, despite the value they placed on eating well, our findings showed that adolescents reported eating minimal fruit and vegetables in the previous 24 hours. In fact, 1/3 of what they ate in the 24 hours prior to the workshop consisted of ultra-processed foods, which was largely wrapped candies. Adolescents from a range of countries also reported that they don't have the knowledge or skill to eat healthily, especially shining a light on the lack of cooking and food preparation skills that they had. It was interesting to hear that through the workshops, participants often spontaneously mentioned body image, indicating that it features constantly in their daily decision-making around nutritional intake. From this activity, we found that 70% of adolescents indicating they wanted to change their current body shape, either to be thinner or larger. Of particular concern is the young age at which adolescents desired an extremely thin body ideal. We found that 47% of 13-year-old participants and 34% of 14-year-olds indicated they desired a BMI of less than 18, which is considered underweight. When asked if they do anything to change their body shape, 86% of adolescents reported engaging in physical activity to actively change their body shape, and 78% actively changed their eating behaviors to alter their body shape. These included specific dieting practices such as intermittent fasting and tracking calories and increasing protein to increase muscle bulk. So before, at the start, you took a quick poll around the influences on food choices. So I'll now reveal what the answer is. So as you can see here, oh, that's interesting. You said peers, and we actually said the adolescents that we surveyed, the 600, greater than 600 adolescents, was that families were actually the prominent throughout the workshops, and they were the major influence on adolescent food choices. They reported that parents tended to make decisions about what families ate and how they ate. They also discussed a range of parental rules and restrictions that shaped their food choices and meals at home. The discussion showed that adolescents had limited autonomy over what they ate, particularly within the home. After families, they actually reported social media as the most influential on their dietary habits, and then came the peers. Adolescents said that social media encouraged them, along with peers, to make unhealthy food choices. Individual factors such as taste also played a major role in determining adolescent food choices. An adolescent commonly reported preferring the taste of unhealthy foods more than healthy foods. While they understood the need for a healthy diet, they expressed a reluctance about eating more fruit and vegetables simply due to the taste. For those in rural locations, they found it harder to access animal protein, fresh fruit and vegetables compared to their urban counterparts. And within the school environment, less than half of adolescents reported that healthy food options were available, which posed yet another major barrier to healthy eating. So in summary, across the globe, adolescents reported that food systems are failing them and that thwarting their ambitions for a healthy future. Adolescents are not getting the nutrition they need. Many regularly skip meals, and some eat the majority of their meals alone. They reported that both home and outside the home food options are hard to find. Healthy food options are hard to find. Affordability and accessibility are key barriers to consuming a nutritious diet. The reality is healthy foods are not readily available in many communities around the world, and when they are cost prohibitive. Young people are calling for a whole community effort to address dietary challenges that are confronting them. As you can see on this slide, adolescents identified 4 priority areas where policy action would make a meaningful difference to the ability to make healthy food choices. To achieve this, all levels of community must come together to ensure adolescents can thrive. So in closing, learning about what really matters and how young people interact every day with their food environments, both physical and digital, is key to enable the conversation with policy and program makers. The challenge then comes to be able to embed ongoing youth-centered engagement in this process that includes decision-making for and by young people at the heart of nutrition policy and programming to create a change where change is most needed. I just want to say that this project was huge and took so many people and hands and brains and a huge power of people to actually make it happen. These are all my co-authors here. We also had a fabulous advisory that gave so much time and knowledge into the project. So I'd also like to thank them, and of course all the participants that participated across the 18 countries. So a huge thank you for you and everyone today and those that participated. Thank you.
Thank you so much, Catherine. That is a very impressive project, extremely interesting. So before we go to any questions, we are going to have the second presentation, and then we'll have time afterwards for questions. So I'd like to introduce Dr. Lynnette Neufeld, who is going to give us a taster on the upcoming Lancet mini-series on adolescent nutrition. So quick introduction, Lynnette is currently the director of the Knowledge Leadership Department in GAIN, the Global Alliance for Improved Nutrition, where she's also part of the GAIN senior management and heads a team of 35 nutrition and food safety experts. So the knowledge leadership team consolidates, generates and facilitates the use of evidence to strengthen the quality of design and implementation of GAIN's programs in low and middle income countries. Lynnette has 30 years of experience in the field of nutrition, where she has worked in several technical advisory and academic positions and published over 150 peer-reviewed publications and book chapters. Wow. Before before Lynnette, you start presenting, we have another poll, if you can put it up. So please answer those 3 questions. And Lynnette, if you have your video and are ready to present. Okay, I can see you, Lynnette. That's brilliant. So maybe I'll pass it over to you, Lynnette, to start, and maybe, I don't know at what point you want these, you will be able to answer these questions. I'll let you decide. Our colleagues will pop up the box with the poll results as soon as, whenever you want.
Okay, that sounds great. Just to double check, are you seeing the proper view of my screen? It's always a challenge with multiple screens.
Adolescent nutrition and neglected global priority.
Right, and it's in full screen mode?
Yes.
Excellent, okay. Thank you very much for the invitation to tell you a little bit about this series. This is, as many of you know, there are several Lancet series on different topics. This is a bit of a spin-off and continuation from the previous Lancet Commission on Adolescent Health. There was a publication in 2016, and after that publication it was recognized that nutrition was perhaps not fully and adequately addressed in that series, and George Patton, who had led that previous series, invited me to join him to pull together a series specifically dedicated to adolescent nutrition. So just to go through a little bit of why we felt this was so important and timely. Many of you are familiar with the life course approach to nutrition. It's taught in schools, it's discussed in many different series. This is a figure from the 2008 Lancet series on nutrition. But often adolescents in that context are included really as their focus of the importance of adolescent nutrition for 1,000 days. So for the reproductive role of women explicitly, and not so much about adolescent health and nutrition even of itself. So if you look here on this box, it really is focused towards actions related to pregnancy and reproductive roles. Adolescents are completely absent from the global accountability mechanisms for nutrition, with the exception of being included, a subset of adolescents being included in women of reproductive age, but not reported separately, not reported disaggregated by different age groups. And other than that single indicator, adolescent nutrition does not appear. And to reflect a little bit on the magnitude of the problem that we are worried about in nutrition, these are some of the data that have been around for a while, and they're known, not generated as a part of these series. That's perhaps a good caveat to mention. I'm actually not going to present the results of the series because we are still in the heat of peer review. So this is just to give you a taste of what motivated it and what's to come. So this is some of the data that was available, and as we know, across many regions, but not all, and across many countries, particularly for now in sub-Saharan Africa, but not all, the prevalence of thinness is declining. But yet, as you can see, in many countries, the prevalence is still well over 20%. That's an enormous burden of thinness, very low body mass index among adolescents. This is specifically among adolescent girls. This trend is less clear and less consistent in other regions, but to a great extent, that has to do with the lack of data that we have from multiple surveys, from recent surveys in countries all around the world. Those types of national data also don't tell us much about what's actually happening in countries. And this is just one slide from the two not so recent anymore national nutrition surveys in Bangladesh, and it is the prevalence of low weight for age among adolescent girls.
Lynnette?
And by region within Bangladesh. Can you hear me okay?
Yeah, Lynnette, just sorry to interrupt, but I think you're not in full screen, in fact.
You're seeing the other display. Let's try that.
Yes, we are. Sorry, it's my mistake. Yes.
That's
thank
better?
You. Yeah,
okay.
Much better. Thank you.
Okay, good, great. Okay, so this is, if we look at these two data, what they've done is they have representative samples by district. And if you look at the comparison between 2011 and 2014, several districts, the prevalence is decreasing. But if you look over here on this far eastern district, the prevalence is increasing. So these types of trends and these type of information are just getting lost with the lack of data and the lack of disaggregated data that we have from many regions and from many countries and from many indicators. On the other hand, overweight and obesity is on the increase almost everywhere. Several speakers spoke about that yesterday. And these are from the Adolescent Lancet Commission data, where they modeled the trajectories if the current trends continue across several countries, particularly in sub-Saharan Africa. You can see that the prevalence just continues to skyrocket up to 40% in many of those countries, between 20 and 40% within the next 10 to 20 years. And this is in adolescence. This is still early in your life. You've got a lot of time to gain weight after this time still. So it's this really concerning prevalences that to be observed at this stage of life. We also know that there's a high prevalence of anemia. This is women of reproductive age compared to the adolescent sample. So adolescent girls 15 to 19 in the light blue, women of reproductive age in the dark blue, and you can see that the prevalence is almost the same across all of the regions that were included in these samples. This is DHS data. Unrecognized, however, has been the risk of anemia among adolescent boys. This is also DHS data, and what you can see here is that in reality, we know the risk of anemia is lower in adult men, but you can see that the risk here among adolescent boys may be higher in several of these countries and quite high in some countries. Why would that be? Could be several reasons. Anemia has many causes, including infectious diseases. So some of this may be anemia related to infectious disease, but adolescent boys grow sometimes incredibly fast. Dealt with that myself with my son, who grew like a weed for about 2 years. And the iron needs related to growth that is so fast are extremely high. So if diets aren't high in nutrients, anemia is a risk. And this is something that has been essentially not discussed and not brought into the forefront of the narrative related to adolescent health and nutrition. So if we take a step back from those data, one could say, well, why does it matter that we look at adolescents differently, uniquely, instead of just looking at those as health and nutrition problems as they are across the life course, as we call it. As you all know, and as we've been hearing a lot about already, adolescence is a unique period of life for many reasons. Roles and responsibilities change during adolescence. The social determinants of health and nutrition change. This comes from the Adolescent Lancet Commission work again. People take on new roles. They're exposed to new media. The role and potential of exposure to peers is different. There's a shift from one's own family of origin to one's family of partnership and of choice and of marriage. So again, all of those structural, community, and individual determinants are very unique during this phase. So what do we know about how to address these problems? This is, again, information that was collated as a part of the Lancet Adolescent series. And what you can see is that for some health issues, sexual reproductive health, HIV, the evidence base to inform programs in different delivery structures is quite strong. You know, you can see here, there are several other areas as well, but if you look at our two nutrition problems that are included in this slide, the evidence is essentially either absent or hasn't been reviewed in a systematic manner. So all of that is a little bit of the background reviews and discussions and processes that led to a decision that a Lancet series on adolescent growth and nutrition was needed. We decided to do so as a 3-paper series, which will be begun as with an introduction, but the 3 core papers that will be review of both existing evidence and presentation of new data. The first will look at an in-depth review of the biology, adolescent growth, nutrition, and development. That's being led by Edward Frangillo from the University of South Carolina and Shane Norris from South Africa. I'm leading the second paper, which with a team of co-authors, obviously, which is looking at food choice in transition, reflecting on adolescent agency in the food environment. And the third paper will bring all of that evidence together to look at strategies for adolescent growth and nutrition. So the idea of that poll came a little late in my presentation, and I was going to ask you to show the results before I went into that data, and I forgot. So before I go on to speak about a little bit more about the structure of the papers, can we see the results of the poll? Right, so we know about the nutrition problems faced by adolescents. Interesting, halfway split. We know a lot, but there is a profound amount that we do not know. Particularly, again, sometimes we have that prevalence data, but looking beyond that prevalence data into what is truly going on and the disaggregation of that in a manner that can be used to inform policies and programs in context is extremely scarce. We know what to do to tackle the nutrition problems, spot on. We don't know as much as we would like to do. And you have all identified correctly that we are extremely under-resourced, and we're hoping that through this series and the recommendations, the concrete recommendations that will be made, we can contribute to a change in that, and that more investment is made on the areas that are needed and have potential for impact. So as I mentioned, the series is still under review. This is a little bit of a glimpse into what to expect. This framework will be a part of the introductory commentary and has been used very much to guide the way we're thinking about the series and the information that we're providing. So if we look down here at the thick dark blue ribbon, the growth and nutritional status of adolescents, and there's a little legend under here that has been cut off: childhood, adolescence, and adulthood. Obviously, this is a continuum. So if we look at that dark blue and the extent to which physical activity, cognitive emotional growth, food choice and dietary intake all influence that, that first bar will be very much the objective and the deep dive, shall we call it, of paper 1. Paper 2 is going to really focus here in the middle on the food environment and agency and how they come together and influence food choice and dietary intake. And a little bit of a review: what do we know about dietary intake and what do we know about the determinants of food choice? And it's unfortunate that that study that was just discussed wasn't yet publicly available. That would have been a great additional source of data, but that's the nature of evidence. It's constantly evolving. Paper 3 is going to bring the whole figure together and really look at this top area and look at the extent to which policies and programmatic action can change the food environment, enhance and help adolescents realize their agency, and work on these underlying determinants, both the direct, which are featured here in this first ribbon of the rainbow, shall we call it, all the way up to the more distal factors that may be influencing adolescent health and nutrition, and the extent to which those can be modified through policy and program actions. So please, I hope you're looking forward to seeing the series. We are in the heat of peer review, as I mentioned, and we anticipate that the publication should be out in the Lancet towards the end of the year, hopefully sometime between October and December, depending on how things progress. Thank you very much.
Thank you so much, Lynnette. Wow, well, we're very excited. It seems a long way still to get it, but looking forward to it very much.
Always a slow process, and particularly complex now, and everybody's been, everybody's lifetime and timelines have been distracted by COVID, unfortunately.
Of course. Yeah, of course. Well, so speaking of COVID, we now have 15 minutes for some questions. And so there were a few questions that came on COVID, in fact, through when people registered. So I'm going to start asking those and then move on to some of the questions that were in the chat box, which colleagues are collecting and feeding over to me. So maybe a one to both of you. The one question, well, two related questions. So the pandemic has potentially serious intergenerational effects that we may need to mitigate. So what should we be doing? And then there was a second question which is related, so I'm giving this one as well, is the role of diet change in mitigating effects of the pandemic on adolescent nutrition. Is it worth encouraging a move back to locally sourceable, highly nutritious food that may have become unfashionable due to changes in taste associated with rising income levels? Any other diet-related interventions and efforts, or more beyond diet? So I don't know who wants to take that. I mean, shall I? Catherine, do you want to start on the diet-related ones? And then Lynnette?
Thanks, Natalie. And yeah, I keep having this moment thinking, you know, what would it be like to go and rerun what we did 18 months ago again now? And I think it would be a very different story that we were getting from participants. So the COVID question is an interesting question. In terms of the locally sourced foods, I think what came from our study was just the complexities of how adolescents view food and the place that it has in their everyday lives. And yes, they are eating huge amounts of ultra-processed foods. A lot of that's driven through aspiring to eat it because they see it advertised, it's eaten around in their peers. But then within the home, they did often always eat more locally sourced food. So I think that it's a complex question that needs to be answered in a way that looks at the interplay of both of those factors. So it's not just that they're not, we're not just eating ultra-processed foods all the time. Has, COVID affected the access to these in places? I can't comment on that. I don't know. But I think that a solution is going to need, again, a youth-centered voice about what the changes have been directly, and just bearing in mind that it's not as simple as upping this access to locally sourced foods because ultra-processed foods aren't available, and the context of how they're eaten within the home and outside the home. That would be my answer to that question, Natalie.
Great, thank you. Lynnette, would you like to add to that?
Yeah, I agree. It's a very, very complex, and we could probably have another 2-day session on that topic. Perhaps what I would like to add is that one of the things, from a little glimpse into paper 2, food environment is so fundamental, and the extent to which COVID is influencing diet, I think equally needs to be nuanced in thinking about the food environment that people are already living and working and acquiring their food in. I think there is quite, not specific to adolescents, but there's quite a bit of work being done now to look at the extent to which COVID is influencing the availability and affordability of food. There's some statistics available around food price. In some countries, it's having an impact on some food commodities. It is on others not as much. If you're interested in this topic, GAIN has been doing what I would potentially call almost like sentinel site monitoring of markets across several countries where we've actually been looking at what's happening in those markets. They're available on our website. I'm happy to put a link into the chat if people are interested to hear about that. But I think we really do need to be thinking about the specific context in which we are working, in which people are living and procuring their foods. COVID is not having a universal effect equally across every region, across every country. And it's really important that policymakers are informed and aware of the reality of what's happening within food systems to be able to adopt the social protection and the strategies and so forth that are needed to mitigate the potential risks.
Yeah, great, thank you. Maybe over to you, Catherine, for some more specific questions. So one quickly is, have these results been shared, or will they be? And then could you just follow on by could you expand on options you mentioned options to regulate digital platforms. What do you mean by that?
Thanks, Natalie. So the findings are in a report, Food and Me, that is publicly available, I believe, on both the Australian Unicef website, and we can include links and share with those. They're also on my slide, is the link and the reference to the report. And I believe it's also available on the general Unicef website as well. So that's the main source of the results. I can see a question there about specifically to India, and yes, we're hoping to there's a lot of data. We have a lot of data, and we are working through disseminating that in several different ways at the moment. Peer-reviewed publications. We will be producing peer-reviewed publications, and I believe we'll also be doing country snapshots. So India will also get its specific sort of report card. So that's for us to come this year. So yes, there is more to come out of what we've got. In answer to your question, I also see Sophie's question there in the role of advertising has played in adolescent nutrition. Huge is the answer, and the regulation intertwines closely with that. And I know there's quite a strong group of academics, particularly from Deakin University in Australia and such, like looking at regulatory responses to this. And globally it does differ depending on the countries, and that I think is the sort of wicked problem in itself, in how do we tackle this. And I was really interested in the discussions yesterday about influencers, because it's not just the push advertising that we think about, the Coca-Cola advertisements, which did come up in our study. We had this activity which was very quickly name your favorite brand, and they had to draw their favorite brand, and Coca-Cola and KFC and those really sort of standard advertisements were coming up. But it's also those subtle influences, and in relation to the COVID question as well, there's been an increase in push advertising through digital platforms, because you've got adolescents learning online a lot more, gaming, they're using a lot of gaming. So in regulation, we need to be thinking not just about limiting what happens in terms of advertising, but also through those digital platforms such as Instagram and TikTok and influencers and whatnot as well. So I'm going to say it's a wicked problem that needs a global response, and I don't have the answers to that at the moment.
Okay, thanks. Thanks, Catherine. Maybe just, can I continue with you, Catherine, because there are a few that came in the chat box while you were speaking. There was a question about taste. You said that's an individual factor, but is taste not only socially acquired by early food experiences?
That's one part of it. There's also biological underlying super tasting aspects with taste as well, which interplay with vegetable acquiring for taste as well. So yeah, I think that again, it's not a simple black and white. So we did place taste individually, particularly because of how they, and remembering that this is talking, it's a thematic coding of discussions and information from adolescents, and they talked about it very much as, I don't like that taste, I do like that taste, or those foods are disgusting, and those foods. So they were very much emotive about their personal view of that food. So that was how we grouped it. The mechanisms underneath how you classify it, yes, agree, I think there's several options, but we were classifying it in how they were telling us about their individualized view of that tasted food. Yeah.
Okay, thanks. And just a last one, well, maybe not a last one, but last one for you from the previously is, could family rules count as adolescent food choices? Food choice to me creates a distinction between decisions adolescents control from those they don't. Any thoughts on that?
Yeah, and I agree. Again, it's not that black and white. So what the conversations that we were getting and the rich data that we were getting was saying that food rules within the home obviously shaped what was eaten, but then they took those with them outside the home as well. They were thinking about, so it was those influences on how, and again, it comes back to those behavioural modelling within the home of what's being eaten, what parents are, the myths and misconceptions that are discussed within the home, and the rules. They then take those with them as they go out, and they're conscious of that in their own space when they're making those decisions. So they did say that rules that were set up within their family were often in the back of their mind where they went and ate elsewhere as well. So it did affect their choice in and outside the home. So I think that it did come back to then guiding their direct food choice.
Great, thank you. And I've got one last question, which I hope someone can answer, that came through actually not during the presentation, but on registration, and again, it's about COVID. Are there changes required in daily nutritional requirements for an adolescent and adults, symptomatic with COVID-19 or asymptomatic with COVID-19? Does anyone have the answer? Either of the panelists, Lynnette, Catherine, or anyone else?
I could open a whole can of worms, but I think there's a lot we don't know about COVID specifically yet, right? And the research is just booming in the peer review, and I have to confess I am not fully up to speed. But I think if we take it away from COVID into the broader picture, the nutritional dietary requirements are set at the dietary requirements for healthy individuals. And exactly how any one illness influences what we call dietary requirements for healthy individuals, I think there's just massive gaps in our evidence related to that. So I think that it is entirely possible that disease, whatever that disease be, affects the body's requirements, both in the sense that it may affect their ability to absorb nutrients, as well as the utilization of those nutrients. But there's just big gaps in our evidence base related to the specifics of that. But healthy diets are so fundamental. If we don't get down into the minutia of exactly how much of each of the individual nutrients we need, eating a healthy diet, we know, is fundamental to recovery from any illness that we have. So that's not a very satisfactory answer, but that's about as far as, at least from my side, I can go.
Well, thanks, Lynnette. And maybe just one last one to you, given that you're working on the Lancet nutrition theories, before we have our break, is if you had, what shall we say, lots of money to do what you wanted, where would you prioritize research in adolescent nutrition?
How much money do I have? Yeah, whatever the amount
billion.
is. I think there are. I think I would divide my pot of money, however much it was. I would divide my pot of money between several different aspects. I think there is so much about the fundamental biology of growth and development that we still are missing. That and those research gaps are going to be highlighted in paper 1. I can't tell you exactly what they are, partly because I didn't write that paper and it's not my area of expertise, but we know there are things that we don't yet know about brain development, about the development of the immune system, and about the long-term, both the immediate and the long-term consequences of both inadequacies as well as the optimization. So it's both the prevention as well as the health promotion component of that. So I would put some of my money into answering those fundamental biological questions. My second pot of money would go into better data so that we can actually quantify the magnitude of distribution of the problem that we want to address in many countries. Many countries have no data about adolescent nutritional status, or they have extremely old data, or they only have somebody draw attention to the fact that the wrong BMI cutoff was used because 18.5 is the adult cutoff. It's not the cutoff that was specifically designed for adolescents. But data are still being reported that way. That chart was pulled down from a DHS report, an older report. But making the investment to get the right data collected and to analyze it and interpret it in the right way, that would be my second pot of funding. The third would be implementation research. What interventions work? We can always build our evidence base, but we know enough that promoting healthy diet is a fundamental need, and how you do that is so context specific, because the reality of the choice and the extent to which individual versus family versus media and all of those determinants vary so vastly by population and country, and within a country by the different groups that are living in that country, that doing proper rigorous implementation research to identify the specifics of implementation, both design and delivery, that's the only way we're going to make interventions effective.
Well, that was amazing. On-the-spot response to a big question. Thank you. Well, I'd like to say we're going to have our 15-minute break, so I just would like to thank you very, very much, both Catherine and Lynnette, for these amazing presentations. Really impressive. Again, for those who want to see them again, they're going to be online on ENN website. Please take 15 minutes break and come back if you could at 10 to 3 UK time, so that's in 15 minutes. Don't disappear, because we've got an amazing panel discussion afterwards. So looking forward to seeing you all back here in 15 minutes. We're going to keep the session live and open. Thanks.
Hello, colleagues. Good morning, good afternoon, and good evening, according to whichever time zone you're joining us from. You all are very, very welcome to the second half and the penultimate session of this webinar. I'm sure the discussion we just had in the previous panel has really inspired and invigorated you. Well, there is a famous proverb which goes, most of you may have heard, that it takes a village to raise a child. I totally agree. But I would like to take the liberty to say that it takes the entire global community to raise a healthy and nourished adolescent. We need all hands on deck, all stakeholders, if we really want to move the needle on adolescent nutrition and the young people and adolescents themselves. I'm sure that, like me, all of you are looking forward to this interesting session, as we have brought together multiple stakeholders comprising of representation from two governments, Ghana in India, UN agency, Unicef, multilateral, USAID Advancing Nutrition Project, and public health agencies such as CDC and academia from Harvard School of Public Health. The session is for less than an hour, around 55 minutes to be precise. And I think with such an esteemed panel, we have a lot to cover, and I'm sure you all may be having a lot of questions as we proceed. I will open the panel with a brief introduction of the panelists as they're sequenced in the agenda, and request them to share their views on various dimensions of the Adolescent Nutrition Program. Once we have had an intervention from each speaker, then we will move on to the Q&A session. And I will request the panelists to respond to the questions, some of which may be very specific to their presentation or to their speech, and some may be general. So without much ado, I would like to start a discussion with our first panelist, Ms. Essie Amoaful. Thank you, Essie, for joining us from Ghana. Could you please, I hope your video is on.
My video is off because I'm not sure of the bandwidth, but I've just turned it on. If you want.
Oh, great! Lovely to see you.
On now. Yes.
Lovely to see you. Thank you so much for joining us. Essie is a nutritionist and a public health specialist, and she's currently the Director of Nutrition with the Ghana Health Services. She's steering the implementation and scaling up of a large-scale school health and nutrition and adolescent nutrition program in Ghana. Essie, we are aware and we have read that Ghana is successfully implementing the Ghana Iron and Folic Acid Supplementation Program, which is also known as GIFTS. It focuses on nutrition of adolescent girls and boys. It will be extremely helpful to hear from you as a policy maker, your experience, and if you could share some critical factors that are needed to mainstream adolescent nutrition in the national agendas. So over to you, Essie. Thank you.
Thank you very much. And greetings from Ghana to all of you, wherever you are. I'm very excited to be part of this panel this afternoon based on Ghana time. I'd like to start setting the Ghana context by saying that recent global and in-country accelerated actions seem to be paying off. And I agree completely with you. It takes a global community to raise a child successfully. And I say this because in Ghana, we are seeing a general increase of awareness about the need to invest in adolescents. And one example is the Burden Adolescent Health and Nutrition Program led by the Ghana Health Service, Unicef, and other partners in the country. And this is linking to other non-health dividends. For example, we are beginning to see a reduction in the occurrence of child marriage. However, we also have not too nice news. The fact that teenage pregnancy is still on the increase. And of course, specifically related to gifts, there's a heavy burden of anemia among adolescents, especially if you look at the reproductive age band as a group. The highest prevalence is within adolescents. Having said that, in order to address some of these issues, especially the anemia prevalence in the country, the Ghana Health Service, working with the Ghana Education Service, and with support from UNICEF, CDC, WHO, and other partners in country, designed a girls iron folate tablet supplementation, simply put as gifts, to respond to this high disease burden. And the program gives weekly iron and folic acid tablets to adolescent girls, both in school and health platform. We've made quite some progress with that. Today, the program is nationwide to all the 16 administrative regions. We built capacity and we are reaching a large number of adolescent girls. And an evaluation that we did in 2018 showed a 26% reduction in anemia and prevalence and improved adolescent knowledge on iron-rich foods. The future of this program is looking at sustaining the gains, and particularly following the reopening of schools, the government working with our key partners are strengthening activities for the continuation of the GIFT program. And we are also looking at integrating GIFT with other actions based in school. For example, the Nutrition Friendly School Initiative that looks at modifying the school environment to make sure that nutritionally adequate and healthy foods that are also safe are sold or served in schools. I'd like to quickly look at some of the issues that we believe are critical factors that have contributed to the success that we are seeing. One is the need for evidence. The generation of evidence to convince both health and non-health actors, we have realized is key. And as I mentioned, the fact that we were able to reduce prevalence of anemia by 26% was a game changer and contributed to the advocacy that led to scaling up the program. There is strong and systematic intersectoral collaboration, particularly between the Ghana Health Service as a health agency and the Ghana Education Service. And this has been very good in creating the enabling environment to roll out the program. And this is also utilizing a national level mechanism that coordinates and oversees the planning and implementation. The third success point I would want to talk about is the strong capacity development and development of tools and guidelines that guided implementation at all levels. We also use strong community engagement to address operational bottlenecks and pass on key information to all actors to address myths and beliefs about the program. And we have integrated adolescent health program and the nutrition program into ongoing health agenda, including the roadmap for UAC and the reproductive and child health and nutrition strategic plan for 2020 and 2025. And we are using innovations. For example, we are considering using artisanal shops, community health volunteers, child health promotion week to reach out to all adolescents, and also the opportunity of the focus on the health sector using the COVID opportunity is also being utilized. I thank you for your kind attention. Over to you, Deepika.
Thank you so much, Essie, for sharing your insights, really great insights, and the point you made about multi-sectorality of adolescent nutrition and bringing the other sectors together and the way it has trickle-down effect, really amazing. And also thank you for being a great champion and steering the program. We'll come back to you. I'm sure there would be very many questions to learn from the Ghana experience. We'll come back to you soon during the Q&A session. Now I would like to invite our next panelist, Dr. Sumita Ghosh from India. Thank you, Dr. Ghosh, for joining the panel. It might be very late for you. Thanks again for your commitment. And Dr. Ghosh is the additional commissioner in charge for child health, adolescent health, Safe Abortion Services Aspirational District Program with the Ministry of Health and Family Welfare, Government of India. She's a pediatrician by education, and in her 35-year career, she has steered family planning program, maternal death surveillance, and various review in the Ministry of Health. She's the technical lead in the Ministry of Health and provides support to national level policy, program implementation, monitoring, and supervision. Dr. Ghosh, India has put in place, which has been well documented and disseminated, and we know that it has put in place world's largest program to improve the nutrition of adolescent girls and boys. We would like to know from you the key components of this program and what is your monitoring strategy across the country. Thank you. Over to you.
Hello everybody. Thank you, Deepika. Nice to talk to the panelists and the audiences here and to tell about our program. We know that India has a very large cohort, 253 million, boys and girls in this adolescent age group. The challenges already have been discussed. The challenges about the nutrition programs in general, the various backgrounds.
Sorry
Yeah.
to interrupt, Dr. Ghosh. Can you please come near, closer to the microphone? Your voice is quite faint.
Okay.
Thank you.
Am I audible now?
Yes, it is. It is better. It is better. Thank you.
Yeah, it's a big cohort we have, 253 million boys and girls. And, adolescent nutrition, it is a vulnerable period and policy making is quite a challenge because of the geographic differentials, because of the social, economic background differentials, because of the various social, cultural differentials in such a vast country. So our programming is basically, we have directed programs for adolescents, that is Rashtriya Kishore Swasthya Karyakram, RKSK, where we are actually having 6 main pillars of intervention, of which nutrition is a very, very, very important one. And there, what we are looking at is into supplementation, IFS supplementation, having counseling, food counseling, the ICBCC activity, education and behavioral change communication activities. We have, a big program for school children, that is a midday meal program, where we give the supplementary diets to a large amount of, school students. Then we have other educational programs, capacity building programs, and counselor programs. So this is basically our all the interventions we do to improve our nutritional status of our adolescents. Very recently, we have launched another program which is basically into education. Along with our Ministry of Education, we have launched School Health Ambassador program, where it's a very ambitious program where we want to catch the young minds and to make them aware of good nutrition and other things at a very young age, through having 2 school ambassadors, teachers who will be trained all over the country in the schools, and they in turn will train 2 messengers from the students who will take up the leadership role, and that will this movement will now spread the education awareness about good nutrition, and various other issues of adolescent health will be taken care of, and that there will be weekly classes on that. So this program is a very ambitious program we have taken into in our fold. We have in our RKSK program, we have a very, very important program, that is peer educator program, because just like school health program and school health ambassador program, where the influentials are the teachers, here the peer group actually they counsel and they look, the groups, same group, it is by the adolescent and for the adolescent. We have adolescent friendly health services. We have adolescent health days. We observe adolescent health days in the villages, where nutrition is an very comes center stage. Another very important interministerial program is our Poshan Abhiyan, of which Anemia Mukt Bharat, because anemia is a very severe public health program in our country, especially in the adolescent age group, girls, like 54% as far as the National Family Health Service survey it told us, and the recent one again has not come out fully, but it is still showing that it is still a very important public health problem for us. So in Anemia Mukta Bharat, again, we have several interventions, and basically they are about supplementation, ions and folic acid supplementation. It is about deworming. Then again, 6 pillars are there. So here we use various testing strategies, non-nutritional anemia also. So different pillars are there. The anemia program is based on T3 strategy, that is
I'm sorry, Dr. Ghosh, I think we have lost you. We don't hear you properly.
You're muted.
now. Is it okay? Can you hear?
Yes, it is okay. So yeah, we just lost in the last part, but I'm sure we will have more opportunity
Anemia
to,
Mukt Bharat program I want to say, because that is a very serious
yes,
public health program, and we have
absolutely.
facility-based approach, community-based approach, and school-based approaches.
Sure.
So there are various programs in place and in collaboration with various ministries, because as we all know, nutrition is a multi-sectoral, multi-dimensional problem.
Thank you. Thank you, Dr. Ghosh. Thanks for sharing the entire multi-sectoral narrative about the National Adolescent Program in Adolescent Nutrition Program in India, and similar to the Ghana experience, how you are bringing all the ministries together. So all parts of the house are there and then working towards a common goal, a common agenda. And I'm sure we will have some questions. You explained about new innovative program where you are converging with the education system to have school health ambassadors to change practices and behaviors to intervene early on. So that's really impressive. And I think we are in a webinar, and I imagine it is a good one. So mostly because our panelists are engaging and inspiring. So I would request the attendees to please share your questions in the chat box so that we are able to maximize the learning from this session. So now we move on to the next session, next speaker. It is my pleasure to introduce Wilma Tyler from Unicef, New York. Wilma Tyler is the senior advisor at Unicef's headquarters in New York. She leads Unicef's global program on school-age, adolescent, women, and food system. And Wilma has an extensive experience of working at policy, research, and implementation in the Europe and Central Asia region, the Middle East and North Africa, and the West and Central Africa region. Thank you, Wilma, for joining us. Wilma, we would like you to share, as an UN agency, what is being done and what is UNICEF's vision on adolescent nutrition. We are aware that UNICEF just released its nutrition strategy, and the narrative is lined out in the strategy on adolescent nutrition. So please do share UNICEF's vision, and also, since this is this is a period which is full of risk and vulnerabilities. So do let us know that how you're working on gender norms to establish gender responsive adolescent nutrition programs. Over to you, Wilma. Floor is yours. Thank you.
Thank you, Deepika, and good morning, everyone from New York. Good afternoon. Good
Wilma,
evening.
before we start, your voice is quite faint, so if you can come closer to the computer.
Okay, let me see. Is this better?
Still faint.
Okay, let me just increase my output level. How's that? Is that better? Deepika?
No,
How is that?
this is okay.
Okay, great. Thank you.
And it's great to see you. Thank you.
Yes.
Over to you.
Yes, thank you everyone, and it's a pleasure to be with all of you today on this very important topic. And as many of you have alluded earlier on, that adolescence is a time of rapid growth and development. It is also a window of establishing dietary habits that support nutritional well-being today and for future generations. So basically, I don't want to preach to the converted, but we all know and have ourselves experienced that adolescence is a crucial phase of life. The adolescents are especially vulnerable to various forms of malnutrition, in part due to their rapid growth and increased nutritional needs. Today, however, too many adolescents fail to consume diets that give them the foundation for long, healthy, and productive adult lives. Especially those in rural areas often have limited access to food options and usually are susceptible to seasonal food shortages, particularly in low and middle income countries. While those living in urban environments are often surrounded by fast food and nutrient-poor snacks and beverages, including those in low and middle income countries. So it will not be an understatement to say that the food systems have really failed our young generation. Moreover, COVID-19 had really exacerbated the situation with the school closures, with the movement restrictions, which have impacted the overall well-being of children and adolescents. So collectively, and again, going to quoting Deepika and others who said that it takes a village, it takes, again, the global community. So us as duty bearers, as practitioners, as policymakers, we all need to join and accelerate our efforts to support children to have a healthy, nourished, and active life. So to answer the question as to what is UNICEF's role, what do we do, what is our strategy, basically, as we all know, UNICEF aspires for a world where all children, adolescents, and women realize their right to nutrition. So recently, UNICEF has released the Nutrition Strategy 2020 to 2030, which is titled Nutrition for Every Child, which sets forth our vision, our goal, and priorities to support governments, primary duty bearers of children's rights to nutrition, and partners in scaling up policies, strategies, and programs to end malnutrition in both development and humanitarian settings. One of the key results areas in the strategy focuses on nutrition in middle childhood and adolescence, and it encompasses UNICEF's programming for the prevention of all forms of malnutrition in middle childhood, which is ages 5 to 9, and adolescents ages 10 to 19 years, which includes school and out-of-school adolescents. To support this vision and the goal, our strategy calls for a systems approach to improving nutrition outcomes. This approach aims to activate the 5 systems: food, health, water and sanitation, education, and social protection, with the greatest potential to deliver nutritious diets, essential nutrition services, and positive nutrition practices for children, adolescents, and women. So UNICEF has identified 5 key programmatic areas that will be delivered through these 6 systems. So we will be focusing on nutritious foods in schools and beyond, healthy food environments in schools and beyond, micronutrient supplementation and deworming, nutrition education in school curricula, and last but not least, healthy dietary practices for school-aged children and adolescents. We recognize the combination of poverty and gender norms circumscribe girls' access to nutritious foods, putting them at a higher risk for malnutrition at a time when the biological transitions of puberty and in many cases pregnancy, childbirth, and lactation render girls' bodies more vulnerable to poor nutrition. So the strategy focuses on establishing gender responsive programs. UNICEF will continue to support programs where gender norms, roles, and inequalities have been considered, and measures have been taken to actively address the differentiated needs of boys and girls, men and women. Such programs go beyond raising awareness and work to address underlying power and structural inequalities to achieve equal outcomes for girls and boys, men and women. Lastly, further to this, UNICEF will collaborate with development and humanitarian partners to advocate for and generate evidence on which scalable integrated nutrition and education packages work to transform girls' lives, as well as to address widespread data gaps on gender-specific adolescent nutrition. UNICEF is committed to advancing the adolescent nutrition agenda and reaching 100 million adolescents with services to prevent all forms of malnutrition. Thank you.
Thank you, Wilma. Thanks for highlighting your thoughts and also the systems approach to deliver results for children and adolescents. You also mentioned, you brought up a very pertinent point about the food systems, which really resonates with what our young leaders and had expressed yesterday, and the awesome video they had shared around subliminal messaging. Good food for thought. Maybe we will have some questions around it. I already see one question focusing on this area. So let's proceed, and I once again request the attendees to please share your questions in the chat box. Keep on sharing. It's exciting. Now we move on to our next panelist, Dr. Addo from CDC Atlanta. Dr. Yo serves as an epidemiologist with the International Micronutrient Malnutrition Prevention Control Team, which is also called IMPACT, in the Division of Nutrition, Physical Activity, and Obesity at CDC here in the US. And as part of the IMPACT team, Yo is actively engaged with partners on micronutrient intervention, effectiveness studies, national micronutrient surveys, and strengthening nutrition surveillance systems in multiple countries in Africa, Asia, and Central America. Thank you, Dr. Yo, for joining us from Atlanta. And Dr. Yo, for many of us, it would be really important to understand how CDC is working on adolescent nutrition and how, since CDC has a very strong background on surveillance, data, metrics, so how data and metrics can be improved in this area of work. Over to you. Thank you. I'm not sure why we lost him.
Yes, Deepika, if you move to another panelist, we'll see what we can do.
Yes, I was about to just do that. In the meanwhile, somebody can support in fixing that. So now we move on to our next panelist. And in the earlier, when I was just discussing this session, and also the other discussants and panelists had mentioned about the multi-sectoral, multi-stakeholder approach. And so it is important to bring each and every perspective to the table. And that is exactly what we will be doing. And we'll hear from our next panelist, Dr. Sasha Lamstein. Sasha is representing USAID's Advancing Nutrition Project, and she is a senior technical advisor with the project. Dr. Lamstein is leading efforts to improve the quality of nutrition services through the revision of pre-service training, the use of digital tools, and the strategic selection and adaptation of service delivery packages. She advocates a systems approach to strengthening the continuum of care for children, adolescents, and adults. And she was with Spring Project, and she championed efforts to increase the attention, to bring the attention and spotlight on adolescent girls' nutritional status and dietary practices. So Sasha, at the global level, you have been sharing a lot around the innovative work you have been doing to strengthen the knowledge exchange and learning on adolescent nutrition. It would be really great if you could share with us all how USAID is supporting through this agenda through advancing nutrition. Over to you, Sasha. Thank you.
Great, thank you. Can you hear me okay?
Yes, perfect.
Okay, good. Great. Well, thank you so much for having me. This is a great opportunity, and it's great to be a part of this community here. So Usaid Advancing Nutrition is Usaid's flagship multi-sectoral nutrition project. It's led by JSI Research and Training and a bunch of other partners. So just to sort of distinguish that we are not Usaid, but we are a primary Usaid project. Our role is to provide technical assistance to Usaid in supporting their multi-sectoral nutrition strategy. My focus has currently been more in the health arena, so I'll speak a little bit more to that, but it certainly is not the end of the work that we do. You know, it's been interesting over the past spring. The previous project, like this one, is kind of a global project that Usaid has implemented, and I was on both. And you know, part of the Usaid strategy has really been the focus on the 1,000 days of pregnancy and through the child's second birthday. Fortunately, over these past 6 years or more, there's been an increased attention to adolescent nutrition, which we're really happy about. And both Peggy Konis-Boer, who's on, and I have really been kind of pushing that agenda and trying to get Usaid on board with us. So, and happily that is happening. Part of Usaid's strategy is to focus on gender equality and female empowerment. So it sort of fits nicely with that. And Usaid also, through our work and through other work that they are funding, is interested in generating evidence and enhancing programming for adolescent nutrition. So that's sort of the backdrop, you know, that it's I guess like everybody, right? The interest in adolescent nutrition is catching on. You know, we were all very focused on the 1,000 days, and then I think there's been a realization that certain populations were getting overlooked. I know we've all established that, and we're all on the same page, but I would just to emphasize that Usaid is sort of making that shift as well and expanding the focus. So under Advancing Nutrition, one of the things that we've done in this arena is recognizing some of the gaps that have been mentioned. I think Lynnette mentioned it, and several others have mentioned the gaps in both knowledge and programming for adolescents. Usaid Advancing Nutrition has developed an online adolescent nutrition resource bank. And Peggy will put in the chat a link to the resource bank so that you can take a look at it. So please do check the chat at some point. The resource bank is not it's some of our materials, but it's really a lot of yours. And we provide links to your websites and to your resources, but it's meant to be sort of a clearinghouse, a bank of different resources to help governments and donors and NGOs and adolescent stakeholders and adolescents themselves to advocate for, design, implement, deliver, monitor, and evaluate programs. So it's really meant to be quite practical and sort of operational resources. We are including some evidence, but we really want it to be focused on sort of like what resources that people can take up and use, obviously with adaptation to context. But so we have examples of policies that we think are good examples, implementation research guidance, case studies, advocacy briefs. There's training materials in there, social and behavior change materials, visual materials, and monitoring and evaluation tools. So there's a lot in there. We're always looking for more. And Peggy has also put in the chat a link to if you're aware of some other resources, you can send it to the email address she's provided. So we're really excited about it. It's just freshly launched. I hope you find it useful, and that's something we're going to be working on, keeping it up to date. And sorry if you're hearing my little Skype pop-ups. So that is, that's that. I did want to just mention before I finish, I hope you don't mind, that one of the other things that we're working on under Advancing Nutrition is led by my colleague Akriti Singh, and I think she's on today. It's the development of guidance for implementers on how to conduct formative research to design nutrition programs for adolescents. Many of people on the call today have done this, so that's, so obviously you are aware of it, but I will say that we're hoping to build on those experiences. And so to develop this guidance, Kriti and the consultant that we hired to work with us on this have been reaching out to many of you and reviewing your resources to pull together this guidance. So that should be coming out, she said, towards the end of the summer of this year. So I guess I just wanted to mention that, and that's sort of where we're at. And we look forward to being a part of this community. It's been great to be on this webinar, but also participate in the ENN interest group and to keep on sharing, because I feel like there's not enough resources out there right now, and we want to make sure to get those out. So that is, I think, where we're at. I look forward to any questions you may all have. And hopefully,
thank you.
Thank
you so much, Sasha, for highlighting all the awesome and interesting work you have embarked upon with the team, and it's really strategic to build the knowledge framework and to bring all the documents, all the resources as in the form of a repository. It will be, I'm sure, it will be very useful to practitioners, implementers, and researchers, and also policymakers. So thanks for doing that. And you have already received a request for sharing the links. So, and Peggy has done that. So thank you, Peggy. Now, I would like to move to our next panelist. Dr. Wafaie Fawzi from Harvard T.H. Chan School of Public Health. Professor Fawzi's research has generated significant new knowledge on the discovery and translation of interventions to enhance maternal and child health and human development, with emphasis on nutritional factors. He established the Nutrition and Global Health Program at Harvard T.H. Chan School of Public Health, which addresses and documents existing gaps, advances the research agenda, and convenes multidisciplinary partners. He has also developed 2 implementation science initiatives in Africa and Asia. So we would like to hear from you today, Dr. We would like to hear from you and ask you to put your research hat on and share with us what are the glaring knowledge gaps in adolescent nutrition, and how, as an academic partner, as a researcher, do you think the nutrition community can address them? So over to you, Wafaie. The floor is yours. Thank you.
Great. Thank you so much, Deepika. I hope you can hear me clearly. It's great to be part of this panel. I enjoyed the prior presentations and yesterday's, so thank you so much for including me. A couple of points really where I hope more research can be done and where we are trying to contribute to that. One is around more understanding of the state of nutrition among adolescents, and the second is around interventions, and both have been raised in many different ways over the past day or two. So I'll touch briefly on both. I know in the interest of time, we don't have a lot, so I'll be brief. On the issue of describing the state of nutrition, we heard that there is quite a bit of evidence on anthropometry-based indicators, particularly thinness, stunting, and overweight. More work needs to be done to address some of the challenges that were mentioned as far as disaggregating 15 to 49. We heard yesterday from Dr. Neufeld and Dr. Roschnik, issues around the references and the cutoff points. Another element really in that domain is to also sort of invest more assessments of the younger adolescent, 10 to 14, and perhaps even younger, as I know Unicef has been advocating for in the sort of later childhood component. But beyond anthropometry, which is, even though it's not perfect, it is much more than what we have for others. I think another area that would be useful to invest more efforts in is around assessment of dietary intake of adolescents. Obviously, it's challenging to collect sort of long questionnaires. So we are sort of working on a tool that aims to assess dietary diversity and dietary quality among adolescents, really learning from the other metrics that exist for women of reproductive age. There has been a lot of emphasis on dietary diversity and the MDDW, but increasingly also focusing on dietary quality and a new scoring system that assesses that global diet quality score that you'll be hearing hopefully more about in the near future, that aims to look at healthy foods and unhealthy foods, and it's really based on food groups rather than sort of nutrients, and so has some of the same benefits as the MDDW, but expands that to be able to look at not only a score that sort of correlates well with micronutrient status, but also is able to assess dietary quality that's relevant to the double burden of undernutrition. So both underweight as well as overweight. So that tool hopefully would be short, can be administered in a sort of field setting, in a field-friendly way. And beyond the tool, the effort obviously would be to scale up that adoption of such a tool in places that would be willing to take it. The aspiration for all of us is to see that DHS is able to lower the age category from 15 to 19 to include the younger adolescents. There are efforts in sort of other places like the DSS, the In-Depth Network, which is a series of demographic surveillance systems that visit households in large communities in various countries. That's another platform that we are working to advance an integration of such a tool within. The second sort of brief point to note is around interventions. And there are other aspects of sort of descriptive and measuring the status, but I'll leave it at diet for now. With respect to interventions, there has been progress. We heard from Ghana and India, excellent work and experience around the weekly iron folic acid and deworming, which is exciting, and lots of lessons from these two settings. I think there is, in spite of the fact that we know this as an intervention, it's a recommendation by WHO for many years, it hasn't been adopted in most countries in Africa and Asia. So an opportunity really to introduce that in various settings where there is a lot of anemia. The second component is to think about other micronutrients that are relevant. So a lot of the emphasis has been on iron and folic acid, but we know in many communities there is multiple micronutrient deficiencies. So one of the elements we are trying to advance is whether building on the evidence that exists a little bit, that's not a lot, but whether there is room for multiple micronutrients over and above iron and folic acid. Again, replicating a lot of the work that has been done among pregnant women, where it is, in my opinion, established that MMS is better than IFA. And so whether by the same token, that could be the case among adolescents as well. But moving beyond micronutrients, my sort of other thought is to sort of think about the other elements that were mentioned, thinking about an integrated intervention approach to adolescent nutrition, considering meals, considering education, considering school gardens as an approach. And we are trying to advance that integrated approach with partners in a number of sites in Africa. I'll end by saying that thank you for including me as a sort of representative of academia. I'm happy to be here. Obviously, there is a lot of interest among fellow academics within the US, within Europe, and definitely with partners in Africa and Asia and beyond to engage. There are lots of opportunities for us to learn from many of the sort of people who are on the ground, and it has been quite informative the last day and a half. Thank you so much.
Thank you, Professor Wafaie. It's always a pleasure to hear you and also work with you. So thank you so much for sharing and also raising a very pertinent and important point about bridging the gap between research and informed implementation. I think that's what is needed. And you shared a lot of information on the dietary tools, and which is much needed at the implementation and at the field level when countries conduct assessments. So to support them, this is required. I'm sure our attendees have gained a lot from you, from your insights, and we'll have more. We'll connect during the Q&A session. So thank you so much. Now I would like to move on to our next panelist, and I hope the technical difficulty has been sorted out, and we have Dr. Yo.
Hello, can you hear me?
Yes, we can hear you, and thank you so much for joining this webinar. And as I mentioned earlier, it would be great to know what CDC is doing around adolescent nutrition, and being a credible agency around surveillance, data and metrics. If you could share with us that how do we improve the data and metrics around adolescent nutrition, that would be great. So over to you. Thank you.
Thank you very much, and I apologize for the technical difficulties earlier. I wanted to zoom out my children who were screaming in the background, and I didn't succeed too well. But thank you. Greetings to everyone, and I thank the organizers for inviting us to share some of the work we've been doing. In terms of we've been as our group, it's in CDC, we have, I would say the question will be, I'll look at this question in a couple ways. There is the domestic nutrition component, and there's also the international. And our group is kind of focused on the international part. And but to say that there are a lot of domestic activities in where adolescent health and nutrition kind of falls part in there. There are units in CDC that are actively involved in this school health and nutrition and school nutrition programs that are involved in the domestic activities. And for example, there is a division of adolescent school health, and then there are also school feeding programs that goes in kind of in collaboration with other school U.S. Government agencies. So that, I would say, in that component, in that bucket, there is some kind of advancement of adolescent nutrition, but then I'm not able to speak to that in that detail because most of our work has been with an international component, which is also another piece there. So adolescence, as people have said a lot already, it's a critical period of life. That's a lot of things going on. So in terms of activities that we do in international work, we all most of the time go with what the countries are working on, and then we help develop we provide technical assistance and then capacity building in enrolling in such programs. And we've been fortunate to be involved in several actually of them. So in terms of our group, some of the things we do evidence-based nutrition intervention in countries in target groups like children, school-age children under 5, school-age children, adolescent girls, pregnant and lactating women, and women of reproductive ages. So some of this is what we've been doing, and what we've been doing also is in a broad frame of things. In some countries, it's been in adolescent, it's in a general nutritional surveys where we tend to find, we've been more and more, there's been surveys that countries are requesting where we provide technical assistance, where we try to fill the data gap. I think the first thing is the data gap, and some of our surveys have been looking at the adolescent age band, not just in terms of disaggregating the women group 15 to 19, and then but we are also looking at 10 to 19 as a whole age band where data collection is kind of being collected in that age band, because if you disaggregate, it's the sampling frame is very different, because you are selecting women and then you are selecting children or school age children. So in more and more surveys, countries are requesting that, and that's something we've been providing technical assistance on in some ways. And then also in some countries also have gone to the next level where we are we've assisted in providing technical assistance in surveillance systems, nutrition and health surveillance systems, where we collect, kind of routine data. One example is Guatemala, where data has been collected for over 10 years, and with this close to 10 years with Usaid colleagues and others being done. So in this way, it's kind of giving a good view of the data that is available in nutrition, and it goes beyond just micronutrient and malnutrition data. We also go into obesity and NCDs and something like that. So this is one of the efforts that we are doing to fill some of these data gaps in international work that we do. And so that's one thing. And also some of the countries like Ghana, for example, where we provided technical assistance, we also know that some of these nutritional intervention programs are very much driven by contextual factors. So most of this, one size doesn't necessarily fit all. So we tend to follow some of the contextual factors, and most times we have some key modules that we help countries develop. And so for Ghana, for example, it was an integrated program. And I would want to put across that integrated program, because it's not just only a micronutrient or only one, it's just a complete approach. So that was how we looked at it, or how we've provided technical assistance. And most of it, I would say, is largely on what the countries are working on and how they want us to help them build capacity and strengthen systems that are not there in the first place.
Thank you so much, Yo, for sharing your thoughts, and also the great work that you are doing, not only internally, but also supporting the various other countries in developing research protocols as well as the micronutrient protocols. I have now I think, like, given a chance, I would not like this panel discussion to end. It's so exciting, so invigorating, and you all are such great panelists. But we have a time constraint, and so quickly I'll just ask, maybe I have one question. I have many questions which we can address later on when we share the workshop report, but a few pertinent questions I would like to put to Essie and Dr. Ghosh, and it is around whether in your countries, Ghana and India, you have been working around adolescent overweight and obesity, and what is the integrated approach that you have adopted there? So I would request Essie to go first, and then Dr. Ghosh. And request you to be brief, because we just have maybe a minute or so for sharing the thoughts, but we can continue the discussion later. Thank you.
Okay, thank you very much, Deepika. Yes, even though the program started around micronutrient malnutrition, recognizing the increasing trend in overweight and obesity, the GIFT program provides opportunity for communication on improved nutrition. But the bigger focus on addressing overweight and obesity is on the Nutrition Friendly School Initiative. I know, Deepika, you provided technical support for that. And that is really looking at improving the nutrition environment of schools and promoting nutritionally adequate, healthy food choices, fruits, vegetables, and also safety, as well as physical education. So yes, over to you, Deepika. Thank you.
Thank you. Dr. Ghosh, would you like to add something?
Yeah. See, it is obesity is again a problem. 11% almost have that, overweight or obesity problem. So all our programs on adolescent health, like adolescent friendly health services, adolescent health days, they are all directed towards this part of this high end of nutrition, also over nutrition. And the school health program, again, we have components, NCD, non-communicable disease, diet and healthy nutrition, healthy lifestyles. So all these are, into awareness generation, creating, the essence in the adolescents that they have to take care of this part also, overeating. Our IEC-BCC programs, that takes obesity into consideration. So it is not that any particular program is directed towards it, but it is ingrained in all our communications as well as our health services.
Thank you so much, Dr. Ghosh and Essie. One last question to Professor Wafaie and and this is regarding, and it's been a burning question. What is the agreed best measure for adolescents? The UK growth chart now in our BMI, but noted that so what is the best anthropometry standardization for adolescents? That's the question. Yesterday there was this discussion whether countries should select IOTF cutoffs or they should select the WHO cutoffs or the CDC cutoffs. So burning question, but we have two experts who can really respond to that quickly. Thank you.
Thank you. I would say that we have, and maybe many others are increasingly sort of defaulting to use the WHO standards and sort of using the cutoffs based on that, rather than the other approaches.
Thank you. Would you like to add something?
I think it's mostly on depends on the outcome. I must say, unfortunately, I'm gonna also, because if you look at IOTF, it's for obesity, and so in terms of NCDs and other things, one will be inclined to be looking at that. But in terms of overall growth, WHO 5 to 19 would be something that you want to look at, and also on the lower side, so from the lower side, you might want to look at that. But I think it's all going to be dependent on largely on the research question at hand, because in some areas and in Americas or something like that, they might also want to, their focus might be slightly bit different because of prevailing health and nutrition conditions. Over.
Thank you so much, and really good food for thought. I know 55 minutes, in 55 minutes really we cannot do justice to the range of topics we covered and the areas we covered on adolescent nutrition, but soon we'll get there, and we'll be sharing the workshop report and addressing most of the questions over there with support from experts. Thanks once again to an excellent and amazing and inspiring panel, Essie, Dr. Ghosh, Dr. Wafaie, Dr. Yo, and Sasha. Thanks a lot. So I'm going to pass on the baton to Emily, who is going to take us to the next session. Over to you, Emily. Thank you.
Thank you so much, Deepika. Really, that was a great panel. You did really well, and thank you to all the wonderful speakers. So time is short, unfortunately, as we said from the start, that's the trouble with the virtual meeting. You can't keep people on Zoom all day, much as we'd like to continue the conversation. We're just going to have a closing now, and Ireland has supported ENN's work in adolescent nutrition over the past few years, and we're so grateful to them for their ongoing support. Ireland has a very well-earned and correct reputation for funding innovative and catalytic work, and often way ahead of other donors or funders. So because Ireland has been so supportive to us and also for helping support this event, we've asked Mary McCarthy to close this event. So Mary is currently Nutrition Lead in the Development Cooperation and Africa Division, and this is otherwise known as Irish Aid, of Ireland's Department of Foreign Affairs. Previously, she's led the research and learning portfolio within the division. And while her background is in education, with 20 years experience as a specialist in education and in global citizenship policy and practice, both in Ireland and overseas, Mary has fairly recently, 6 months ago or so, taken on the nutrition portfolio and has picked up all the key tips and tricks of nutrition incredibly rapidly. So I'll hand over to Mary now and say thank you.
Thank you, Emily, and to everyone who is gathered here virtually. I'm delighted to be here on behalf of Irish Aid. And I just want to say, first of all, a huge thank you to ENN, to all of the panelists, and indeed all the participants in this two-day meeting. ENN is a long-standing and trusted partner of Irish Aid's, and are equally no strangers to innovation, and this event is one of those examples. So delighted to be here. And as Emily has said, my background is also in education and youth engagement. So this focus on adolescent nutrition is critically important, but also of great personal relevance and interest to me. So I, first of all, in terms of closing, I just wanted to commend you all on the great engagement over the past 2 days. I understand there have been over 300 people who have joined this remote meeting, and you've all been very active in the chat box. So this is obviously a topic which is really resonating with so many people. And as we've heard, and what perhaps has brought so many of us in these numbers to this meeting, is really adolescence as a period of rapid growth and development, which influences longer-term economic productivity and susceptibility to disease, as well as that intergenerational cycle of health and well-being. It's critically important, but there are still so many gaps in terms of our understanding around the scale of adolescent malnutrition, around effective interventions, and most importantly on how to meaningfully engage young people in devising appropriate solutions. And this point on meaningful engagement is particularly important to Irish Aid. As many of you may know, Ireland has made a commitment to reaching those furthest behind first in our international development policy. And we define those furthest behind not only as those who may be economically poor, but also those who may lack voice, agency, or representation. And too often we see that young people may not be listened to the degree that they should be, or if they are, this can happen in a tokenistic or a tick box fashion. So if there's one takeaway really from this two-day meeting, it's the absolutely essential point to listen to a wide range of youth voices, because they're not homogenous, and to bring these voices into decision-making and in working towards sustainable solutions. I've only been able to take part in one small part of the event, regretfully. This morning I was chairing a panel on the importance of breastfeeding in terms of a pillar of lifelong good nutrition, so highly relevant to today. But I know that we've all listened to a wide range of information throughout the 2 days. So I'd like to just briefly sum up here to recap before we all go off for the rest of our days and evenings. So yesterday we heard from ENN on their work on mapping of interventions and indeed policies, as well as looking at estimating current levels of malnutrition in adolescents across the world. And we then heard about Empatika's fascinating immersive research in Indonesia. A definite highlight was certainly the youth panel, an incredibly dynamic group of young people committed to driving real change and incredibly articulate. And this is particularly heartening to see at the start of 2021, which is such a critical year for nutrition and food systems. And our hope is that these voices are carried through to some of the key global moments this year, be that the Food Systems Summit, COP26, and or the Nutrition for Growth Summit. And we're particularly delighted that Sophie Healy-Thau, one of Ireland's own, was there to moderate that panel so effectively. Today, on day 2, we heard about the interesting research from the University of Western Sydney in collaboration with Unicef on how adolescents experience nutrition across the world. We then heard about the upcoming Lancet series on adolescent nutrition, which we're all really looking forward to the release of. It's really important. And finally, we've heard a range of thoughts and experiences from the government and organisational panel, where attempts were made to make progress towards Objective 2 of this meeting to explore priorities for assessing and improving adolescent nutrition across policies and programmes. And by the sounds of it, that particular discussion could have gone on for another hour with no problem whatsoever. So let's this be the beginning rather than the end of these really important discussions. Time has been short. I know we've managed to have really useful conversations, but there is still a long way to go in terms of adolescent nutrition. So I really hope that these can continue constructively and that we can build on these key global moments that are happening this year. I want to also convey on behalf of everyone who's taken part a note of thanks to a number of different people, because it's a great deal of effort to organise such a wide-ranging and multifaceted virtual event such as this. So first of all, to all the presenters and panellists for generously sharing your thoughts, experiences and insights, hugely appreciated. Deepika Sharma from Unicef and Natalie Roschnik from Save the Children for all your valuable input in devising, planning and hosting the event so ably. To the ENN team, Laura and Abby have provided essential, although largely invisible support. That's a note of success with all the technology and making sure the event ran smoothly. And also to Natasha and Stephanie for being such enthusiastic and learned members of ENN's adolescent team. Finally, I really want to thank Emily Mates and all the senior leadership team in ENN for the dynamic organisation and convening and for really highlighting this really crucial but sometimes overlooked part of the nutrition agenda. Your efforts are hugely appreciated and thank you very much. So overall, I just want to reiterate that adolescence, this really intense period for so many reasons, needs to remain at the forefront of our minds, and more attention is required in these years ahead, and particularly in this year of action on nutrition. So I'm sorry I couldn't join for more, but glad to be here and look forward to linking in with some of you bilaterally and wishing you a good rest of your day or evening. Thanks, Emily.
Thank you, Mary. Exactly on time. We're going to end. Let's continue on the conversations. Thank you, everybody, for your enthusiastic participation.